My name is Dr. Sepilian, and I am a reproductive endocrine and infertility specialist. An infertility specialist is a discipline within obstetrics and gynecology, a subspecialized physician who takes care of patients and couples seeking to have children with any type of fertility issues, infertility issues, and fertility preservation. Our patients are typically couples, heterosexual couples seeking to conceive, single individuals, both men and women, seeking to have children, and individuals who want to preserve their fertility and all kinds of related conditions. Today we're going to talk about what is an infertility evaluation. When a couple, a heterosexual couple who's trying to have a child and has been experiencing difficulties. By traditional definition, infertility is when a couple has been trying to achieve a pregnancy through regular intercourse for a year without a positive result. That 1 year is reduced to 6 months if that couple's age, the woman's age, is over the age of 35. Now, we're going to go over what one should expect, or a couple should expect, when they come in for an initial infertility evaluation. So, if a couple indeed meets the criteria, then it is recommended that they do see a fertility specialist who specializes in treating these types of cases. So, initial visit typically comprises of a consultation where we get the information, historic information, age, past pregnancies, if any, past gynecologic history, past medical history for both the man and the woman, past surgical history, any medications, supplements, or vitamins that they may be on, any allergies to medications, any family history of any type of hereditary or serious medical conditions that run in the immediate family. And we also want to know about the lifestyle of that couple. Do they smoke or use any tobacco products? Do they use alcohol, and how often and how much? Any recreational substances, whether it be marijuana, edibles, pills, mushrooms, and whatever have you. We also want to know things like caffeine consumption, amount of exercise, and what do they do for work. Some occupational hazards may contribute to one's ability to conceive and become pregnant. Once we get this history, then there are several things that we want to evaluate, and there are some tests that we typically order. These are typically, we want to know from the woman's side if she is ovulating regularly, and we will get an idea about that based on her menstrual history. There's also some blood work that we can order that will let us know if that woman is indeed ovulating. Of course, ovarian reserve is one of the most important factors. How many eggs are there in the ovaries? And through doing a set of blood work and an ultrasound, counting the eggs that are in the ovaries, we're able to get an idea of what the ovarian reserve, or how healthy is the ovarian reserve of that woman based on her age group. We also want to make sure that the uterus or the womb is healthy without any abnormalities, things like fibroids, polyps, scar tissue. Some congenital malformations of the uterus can interfere. And by doing an ultrasound, a pelvic ultrasound, we're able to know if there are any such abnormalities. Of course, we want to know if the fallopian tubes are open, and in that case, we order a test called an HSG, a hysterosalpingogram, which is typically done in a radiology center. A catheter is placed inside the uterus, a radio-opaque dye is inserted, and if the fallopian tubes are open, we'll be able to see on imaging that the fluid was able to go through the uterus and the fallopian tubes, and that the fallopian tubes are free of any blockages or abnormalities. On the male side, of course, we also want to get a detailed history, and we typically order a semen analysis to rule out any type of male factor. And in the semen analysis, we look at the volume of the seminal fluid that was produced. We look at the acidity, the pH. We look at the concentration, how many sperm cells there are per milliliter of fluid. Typically, we're looking for at least 15 million per milliliter. We want to know what percentage of those sperm cells are moving, the motility, and we want to know also what percentage of those sperm cells have normal size and shape, and this is a morphology. So by gathering this information, it will give us a pretty good idea of what's going on. If there are any problem areas, by doing these tests, we're able to focus on those areas and overcoming them or correcting them. If there are abnormalities that could be corrected surgically, typically we work with a gynecologic surgeon to remove a polyp or remove a fibroid that may be causing infertility, and so on. And we can try and come up with a solution so that that couple will be able to conceive and become pregnant. Just to recap, typically when we see a couple who's experiencing infertility, we do a detailed history and a pelvic examination and a pelvic ultrasound, a comprehensive pelvic ultrasound, to look at the uterus, the ovaries. We count the eggs that are in the ovaries that give us an idea of their ovarian reserve. We also do a semen analysis that tells us how much seminal fluid there is, the sperm count, movement, and the morphology, which is the quality of the sperm. We also do a set of blood work on both the man and the woman, a hormonal panel looking at ovarian reserve, other hormones, things like thyroid function, vitamin D levels. We want them to be optimal for any woman who's looking to become pregnant. Another important test that we do is we do a genetic carrier panel to make sure that both individuals within this couple who are going to be procreating together genetically are compatible and don't have any, they're not carriers of a genetic abnormality that would cause the risk of transmission of a full-blown genetic disease to the child. And by doing a simple blood test, we're able to make sure that that couple is not a carrier of the same genetic condition that then can be passed on to the child. Typically, the consultations for a fertility evaluation can be done virtually via Zoom or via a phone call or in person. We prefer that the couple meet with us together so we can get all the historic information. Following that initial consultation, we will then arrange for the pelvic ultrasound to be done, the semen analysis to be done, and the blood work for both individuals. And once we have the results, typically the results take about 2 to 3 weeks for everything to come back. We typically will regroup, review all the results. If there are any problem areas, we will focus on overcoming or correcting those problem areas. Otherwise, we will discuss what the treatment options are. Common treatment options are doing ovulation stimulation to correct if there's any ovulatory dysfunction. If there's a male factor, there are some options either in doing an intrauterine insemination or IVF. And other variations of treatments are typically discussed, and the decision on how to proceed is made jointly together, depending on how comfortable that patient or couple feels and what type of treatments they want to do. If you have any questions about any of the information or content in this video, please reach out to us. You can do so through the website or call us. We can set up a virtual appointment or an in-person appointment to discuss this or any other fertility management.